CGTN, China Global Television Network.
The coronavirus has so far been confirmed in some African countries. The head of the World Health Organization warned that public health officials are operating in uncharted territory as they combat the virus, which has so far affected more than 120,000 people worldwide. In February, the World Health Organization met with African health ministers in Addis Ababa, Ethiopia, and pledged support to African Union member states in their fight against the virus, also known as COVID-19. Africa's Centers for Disease Control and Prevention has also activated its Emergency Operations Center. This week on Talk Africa, we look at patterns of the coronavirus spread across Africa and what steps are being taken by African countries to combat it. I'm Beatrice Marshall. Welcome to Talk Africa. And joining me now to unpack Africa's preparedness regarding COVID-19, I'm now joined from South Africa by Professor Shabir Madhi. He's a professor of vaccinology at the University of Witwatersrand in Johannesburg. With me here in studio, Dr. Samrat Shah, medical director and consultant physician at Medihill Hospital in Nairobi, and Vincent Ngede, the Kenya deputy editor of Africa Check. Now, Africa Check is Africa's first independent fact-checking organization. Gentlemen, welcome to the program. Dr. Samrat Shah, let me start off with you regarding what is going on in terms of preparedness for the continent. We are seeing some cases in Africa now of COVID-19, a few and fine between, if I may put it that way. How big a threat is COVID-19 posing for Africa?
You see, I think COVID-19 is going to be a big threat for us because I feel the detection rate is less. It's not that we have less number of cases. We are not able to detect them because let's take the example of Kenya. We did not have machineries or test kits to do the test till now. We had them last few weeks back. So coronavirus, this time what has come, it is more of asymptomatic in 80% of patients, or even if it is symptomatic, it comes with common cough and cold. We are not testing all of them. So I feel the number which we are seeing in the African continent is less because of less number of being cases detected. It's not that the virus load is less. It cannot happen that the virus load is less only in Africa, and apart from Africa, everywhere else across the globe it's going high. And now, since the time the detection is being started across the countries, so now the number is going high. It's because we are able to detect these tests now. So you need to have testing centers in every country for that matter. And if possible, every county should have it because it's a pandemic virus now. And unless and until we have the testing facility available easily, we are not going to have those number of cases being detected as it's being detected in China or other parts of the world because the testing is easily available. I think we need to be more prepared to have those testing facilities, not just testing facilities. In fact, we are even lacking in terms of technology, in terms of isolation wards, in terms of emergency services, in terms of ICU care available in the country. Like we cannot have just one hospital in a country which can take care of the pandemic. That's not going to help.
Right. Let's get the example from Professor Shabir Madhi in Johannesburg. Professor, what kind of patterns are emerging regarding the disease and its containment on the continent?
So I think I completely concur with Dr. Shah that I think what we're facing at the moment in Africa is that even though there are a number of countries that have developed the capacity to do testing, they don't necessarily have the capabilities to do the type of testing that we actually require and to actually do the type of surveillance that we require to truly understand the magnitude of the problem on the continent and in African countries. But what we don't know at this point in time in South Africa and in any of the African countries is whether there's local transmission of the virus, and that is really important. Now, the type of strategy that's been adopted in South Africa up to now has been really targeted at a specific group of individuals that have traveled or that are in contact with someone that has traveled. To be able to truly understand whether or not there's community transmission of the virus, what we need to do is we need to change the paradigm in which we undertake surveillance. Right. And what we need to now start doing in South Africa, as well as in other countries, is we need to start systematically investigating any individual that presents to the hospital with severe pneumonia that's an adult, we need to routinely investigate them for coronavirus infection to see whether there's actually local transmission.
Right.
So it really requires a change in terms of the approach that we use when actually deciding who we're going to investigate, and that will determine to what extent Africa is already affected by this virus.
Right, let's look at that change in a moment, because we are now joined by Professor Akin Abayomi. He's joining me from Lagos. He's the Lagos State Commissioner for Health. Can you give us an understanding of the strategies that Nigeria has put in place to ensure that the outbreak does not spread in Lagos?
What we've done in Lagos is to make sure that we've made entry into Lagos through our international airport extremely tight in terms of surveillance of all travelers coming in from Southeast Asia or coming in from any of the rapidly changing outbreak dynamics anywhere else in Europe and the Middle East. So we changed the criteria for surveillance of passengers who we need to ensure we give them the information that they need to isolate themselves at home on entry into Lagos. So that's what we call supervised self-isolation in their homes. And these are asymptomatic people who are traveling from countries where there's person-to-person transmission of coronavirus. Of course, if you're symptomatic on arrival and we pick you up on any of these flights, whether you are coming from a high-risk country or not, then we will move you from that environment to our isolation facility, which is a very well-established facility in Lagos. Following on the Ebola outbreak that we've had, we've managed to develop isolation wards and a BSL-3 laboratory, an emergency operation command center. And so that facility is very well established and operational. And we move affected passengers to that facility where we put them in isolation and run our tests until it's clear.
Right. Professor Abayomi, I do also want to get another understanding of the contact tracing that you've put in place, because so far we do know that one person who came into Nigeria was the original index number. But what progress did you make, though, in terms of contact tracing of anybody he may have come in touch with?
Okay, so we had several points of contact where this traveler made before he was diagnosed while he was in Lagos. So he was in Lagos and a neighboring province for about 3 days until he fell ill. So we're able to backtrace everywhere from the company that he came to work with to the drivers that moved him around, to the hotel where he stayed in overnight in Lagos, and to the entire airline that he traveled on from Europe to Lagos. And we've been able to identify everybody that could have been in contact with him. And all those individuals are being followed up by our surveillance team. And that was how we were able to pick up this individual who was a close contact of him. And then we were able to subject him to testing. And that's how we picked up the second case.
Professor Shabir, though, when you look at Africa's health security, when you look at the measures Nigeria has put in place and the measures South Africa has put in place and the measures that other countries had put in place during the Ebola outbreak, what does this tell us, though, about Africa's health security?
So I think there's two parts to the question. The first part is obviously Ebola and the coronavirus are very different in terms of the dynamics of the transmission. And Ebola probably is easier to contain in terms of spread in the community than the coronavirus. And at some stage, I probably would like to sort of just unpack some of what's happening in South Africa. The type of strategy of screening at the ports of entry to identify cases is actually completely suboptimal. So I think that we're being highly optimistic if we believe that we can actually contain the spread of coronavirus on the African continent in the same way and by doing the same type of things that we did for Ebola. Now, when it comes to Ebola and what it told us of the healthcare systems in sub-Saharan Africa, at least in those countries that were affected, is that we've got a highly fragile healthcare system which doesn't have the bandwidth to take on any additional burden of disease, be it South Africa, be it Lagos, be it Sierra Leone, be it DRC. The reality of Ebola on the African continent is that with all of the assistance that it received eventually, there were more people that ended up dying, not from Ebola, but from measles. And what that tells us is that the entire healthcare system simply crumbled under the added burden of having to deal with the Ebola outbreak.
So, Professor Abayomi, the World Health Organization has, called it a pandemic. Why did it take so long to do this?
You know, it's very important that we balance the ratio of public health impact with economic trading routes. And I think, you know, you don't want a double-edged sword where you're suffering from an outbreak and at the same time you're cutting off your trading routes and you're disconnecting people from their opportunities for livelihood. So, you know, we have to maintain our trading routes as much as possible without compromising our public health integrity. So we're trying to do that balancing act in Lagos because Lagos is the commercial hub of Nigeria. We don't want our economic livelihood to undergo a depression, but at the same time, we want to make sure that we strengthen our surveillance and make sure that we're doing everything possible to prevent an outbreak in Lagos. The coin may flip at any moment in time, and if that happens, then we will have to move into a different gear and start to ensure that we exercise public isolation policies, and that, of course, will have a major impact on our economy.
Right. Vinta, let me bring you in at this point because one of the issues that we have been dealing with is the issues of getting the information out to the public, credible information to the public, information that can assist the public make informed choices on how to protect themselves and how to prevent themselves from getting infected. But there has been a lot of misinformation regarding what exactly coronavirus is. Why do you think there has been so much misinformation?
Well, people have different motives for spreading misinformation. A lot of people want to do it because it gives them influence and a following online. So, you know, if you go on Facebook and you spread a false story, you're going to get a lot of followers, you're going to get a lot of likes, and, you know, digitally, those are things you can monetize. So once you have a big crowd online, that helps you to grow your influence on the internet, on Facebook and on social media. So that is one reason why people would put misinformation on social media. The other is obviously that is more explicitly money, right? So there are people who typically spread and peddle fake cures. And it's not only with the coronavirus. We've seen this for other diseases, you know, be they diabetes, be they cancer, but there are people who are in that business of trying to get fake cures, people to buy things that don't work. And when they have people who believe them, they have this captive market, so they can give talks. If it grows, you know, you can give talks, you can sell books, you can do all kinds of things. So there is that explicit financial angle. A very interesting thing happened just a few days ago. I think we noticed there was a report in the news that was found to be false about a fake BBC account that said that the actor known for acting Harry Potter, Daniel Radcliffe, had coronavirus. And the people who wrote that, because BuzzFeed did track down the people who actually did it, and they said that they were just trying to fool around with people and show that they don't think.
Are we seeing at this point, because the pandemic, the outbreak has been around now for a few months, are we seeing a change of perception from the people? Are we seeing a better understanding of what it is, or are we still dealing in the era of misinformation?
The misinformation continues being produced. There are always people putting things out. In the earlier days of the coronavirus becoming well known, there were people who were talking about all manner of cures, that you can cure coronavirus by eating garlic, vitamin C. Someone mentioned, animal urine, marijuana, all kinds of things. What happens is that people keep finding new stories, and they keep reusing even things that have been used in misinformation previously. So there was a photograph, for example, of the Ebola outbreak in 2018, when the Ugandan health workers were photographed, and someone said, these are coronavirus workers, but it's an old picture. So we find a lot of that recycling of content that has been used before to to sort of fool people and misinform them on what is going on.
All right, we are going to take a short break now. Gentlemen, do stay with us because when we come back, we look at what more needs to be done to bolster Africa's preparedness. To stay with us.
Life moves pretty fast. Ideas move at the speed of sound. Technology moves at the speed of light. If you don't filter out the noise, you might miss the details. We pay attention to the details because they matter, showing you a different perspective. See the difference.
Welcome back to Talk Africa. Still with me are Professor Akin Abayomi in Lagos, Professor Shabir Mahdi in Johannesburg, Dr. Samrat Shah in Nairobi, and Vincent Ngede, both joining me here in the studio. Well, before the break, we looked at some of the patterns of the coronavirus in Africa. Let's now take a look at what more can be done to bolster Africa's preparedness. Before I get there, though, Dr. Samrat, I want you to take us through, because I know a lot of people know what you need to do to prevent, to help yourself, to stop the infection and so forth. What are some of the basics, though? If you can just take us through the basics of the do's and don'ts.
Yeah. The basic thing about coronaviruses, this is a virus which spreads by droplets. There are people who are talking that it is an airborne disease. These things are not true. It's a droplet-borne infection wherein it spreads mainly by coughing and sneezing. It's a droplet-borne infection. So some basic measures what you need to follow is, when you cough and sneeze, make sure that you flex your hands, close your nose and mouth with your hands, and then cough and sneeze. The moment you cough or sneeze, you make sure that you wash your hands with soap and water, at least for 20 seconds in a running tap water, and you make sure that you clean every part of your hand. It's not that you just wash your hands and come out. For at least 20 seconds, you need to wash each and every corner of your hands. If not possible, if you can use a sanitizer, which can be an alcohol-based sanitizer, which should have at least 60% of alcohol. That's the basic thing to be done. You always make sure that you sanitize your hands with soap and water or with alcohol-based sanitizers. Apart from this, the basic measures one need to take is, if you are having fever, cough or breathing difficulty, make sure that you isolate yourself. Stay in a room where you are not going in contact with many people. If possible, isolate yourself in house. Make sure that you isolate everything possible for yourself. The plates you use, the cups you use, the monitors you use, the washrooms you use, everything needs to be isolated. Especially now when it's a pandemic, because you never know whether you have corona or not. As we rightly discussed, that is 83% of people, they don't have many major symptoms of coronavirus. They just have fever, cough and cold like a common flu. So make sure that you isolate yourself at home. Make sure that you reduce the contact with people. You can have contact via telephones. We have telecommunications available right now. Avoid going into public places at least for 14 days since the point of you having these kind of symptoms. Make sure that once you are symptom free, completely free from all the symptoms, then you start coming in contact with people. That's the first thing at an individual level what we need to do.
All right.
If we talk at community level, we need to make sure that all the community gatherings are to be avoided. If we talk about schools, inter-school gatherings should be avoided. Business places or workplaces where they have shift, make sure that the shifts are not occurring on the same time. Like we see people coming at 6 o'clock and going out at 6 o'clock. A lot of people gather at 6 o'clock at that point of time. Make sure that the entry point is separate and the exit point is separate.
Right.
Like 5 o'clock you can have an exit point, and then 6 o'clock you can have an entry point. So avoid gathering too many people at a time. Apart from that, at the government level, we need to be prepared ourselves for having a good government centers,
Right.
wherein we have emergency services in place, communication system in place, transport system in place, and we have dedicated ICU, including the thermometers, the blood BP apparatus. Everything should be isolated for that group of people only.
Professor Abayomi, let me get your thoughts here regarding the government preparedness, as Dr. Samrat has mentioned, the various levels, the public, the personal and the government. In terms of African governments, what should African countries do as first steps to respond to the pandemic?
Well, I think every country will have to look at it differently and depending on their capacity. But there needs to be a really significant mobilization of human resources and financial resources to impede the opportunity for this virus to enter into their communities. So for us in Nigeria and in Lagos, we've really ramped up our defense in terms of entry through our airports. We've increased community awareness. We made an initial underestimate of where the index case may come from. The focus was on Southeast Asia for many weeks. But as we started to see an increased number of cases and person-to-person transmission in the Middle East and Europe, we should have diverted our attention much earlier to a possible entry route from Europe and the Middle East. But notwithstanding, we now are more informed, and we now know to expect it from anywhere, because as the outbreak spreads across the globe, an entry into the country can come from anywhere. So that's our first line of defense. The second line of defense is obviously to raise the index of suspicion amongst all our doctors and healthcare providers and the community at large, to bring to our attention through our emergency numbers, the suspicion that may be in community, and to have the number of healthcare professionals respond to the public information that comes through. So when we receive any information, we should be in a position to respond very quickly, to visit the area and to assess what's going on, and then to take decisive decisions and actions. It's very important that we break the cycle of transmission between possible infected people and the rest of their community. And you can only do that with very robust public health care strategies to isolate people either at home or bring them into a facility where you can isolate them and contain them effectively with appropriately trained personnel, and always looking out for information and awareness in the community, and to ensure that our healthcare professionals are not put at risk.
Professor Shabir, looking at the lessons that other countries can learn from South Africa's from the outbreak in South Africa, what kind of lessons can be learned by other countries in terms of preparedness and in terms of preventive measures with the COVID-19?
When it comes to preparation, I think that the horse has already bolted in terms of our ability to actually contain a virus on an African continent from actually resulting in local transmission. I think we would be naive. I think what needs to happen right now is governments need to start recognizing that the virus is going to establish itself, however much we don't want to admit it. This virus is going to see itself in Africa as far as I'm concerned. The issue that we face is how do we actually start managing the individuals that are going to come in with severe respiratory distress. But that doesn't call for to be completely alarmist. I think what we also need to realize about this virus, right, is that the mortality rate from this virus is fairly low, and it's a specific group of individuals that are at greatest risk of the most severe disease. So what I'm saying is that, yes, we're concerned about coronavirus, but I think we need to be careful about imagining that we can actually stop the circulation of this virus in our communities. It's a respiratory virus, it's transmitted with respiratory droplets. The type of screening that we got at our facilities, the ability to actually trace every individual that comes into your country is non-existent, not only in South Africa, but even in the United States.
Right.
The last few cases we've had in South Africa over the past 24 hours were not travelers to Europe, were not travelers to China, they were travelers from the United States. You do not simply go about trying to isolate people, quarantine people, and imagine that you're going to be successful in terms of the local transmission of the virus.
Right, gentlemen, we're going to wind up in a minute, and I want to get your final thoughts on this. Professor Abayomi, let me start off with you, though, because Professor Shabir has talked about the virus likely to establish itself. So in terms of long-term goals in eliminating it or combating it, what are your thoughts?
Well, it's quite possible, and I agree with him, that the potential for the virus to establish itself in many countries in Africa is quite high. What we're doing in Lagos and Nigeria is to buy time. And we're buying time by limiting the opportunity of this virus at this point in time when we have the upper edge and we have the advantage to slow down the establishment of the virus in our community as we now deploy resources into community, such that whatever policy we adopt when and if it establishes itself, we've ramped up our capacity to deal with severe cases, and we've educated the community. So we're hitting it hard early on, and we have the time, the resources, and the opportunity to do that so that we can slow down its process. And that's the strategy that we're using in Lagos and in Nigeria.
Right. Dr. Samrat, your thoughts?
I think what is being told is very right. We cannot stop the disease from coming into the country. We cannot prevent corona from coming into the continent. But what we need to do is individually everyone needs to be educated about this, try to prevent this as much as possible, restrict every entry points as much as possible, get time, because it was, I read a study which was told that the medicines for coronavirus will be, we are expecting to come them with June 2020 and vaccination is expected to come by July 2021. Because they are in phase 3 trials already. When the medicines are in phase 3 trial, it doesn't take a long time for them to come. So I think education to the people, passing on information to people is what is required right now.
Right, in terms of passing on correct information to the people, Vincent.
Well, people need to find credible information. That means we need to look to ministries of health, we need to look to the World Health Organization, and we need to look to accredited experts and be very skeptical about social media. Generally, if social media accounts dispensing this information are not from institutions that are accredited and that are verified identities on social media, this is one big thing that you can look at, then we need to be very skeptical about taking that information and passing it on. And if people have doubts, then they need to contact these institutions, so ministries of health, experts who are accredited, or even fact checkers like us, because we make it our job to dig and hunt for those answers.
Professor Shabir, you have the final word.
The time has come for African countries to actually prepare for local transmission of the virus, for an increase in terms of the demand for curative healthcare services. I think that's what needs to be done. But the reality is that you do not build curative healthcare services in the midst of a crisis. So what we also need to do is we need to be cognizant of the other diseases which are highly prevalent in our countries. And we need to make sure that while we're responding to coronavirus, that we don't lose eyesight of those other diseases, tuberculosis, malaria, TB, HIV, which are going to kill more people on the African continent in the next 2 months than coronavirus will probably kill in the next 12 months. So we need to be guarded that we don't actually undermine the importance of continuing the type of services we're able to provide whilst we try to scale up our response in terms of providing additional curative services to deal with the added burden of coronavirus.
All right, gentlemen, very interesting insight. That's all we have time for this week on the program. But thank you to my guests, Professor Akin Abayomi. He's the Lagos State Commissioner for Health. Professor Shabir Mahdi, Professor of Vaccinology at the University of Witwatersrand. Dr. Samrat Shah, Medical Director and Consultant Physician at Medihill Hospital in Nairobi. And Vincent Ngede, the Kenya Deputy Editor of African Check. Remember, we'd love to hear your feedback through our social media handles on Facebook and Twitter. And you can also catch the show on our YouTube playlist and keep the conversation going, and tune in again next week for more Talk Africa. From me, Beatrice Marshall, and the teams in Nairobi and Johannesburg, it's goodbye.